So Sophia's been admitted to the hospital, and I'm the nurse caring for her. She seems upset today because she's been having some really bad headaches and she's concerned. So I'm going to go and talk to her and see if I can figure out what's going on. Hi, Sophia. It's me, Laura, your nurse. Um, how are you feeling?
I'm okay, I guess. My head still hurts a bit.
You seem a little bit upset. Can you tell me a little bit about that?
I'm worried about my headaches. They keep coming back, and I don't know why.
Okay, well, I want to talk to you a little bit about that. Before we do, I just want to check your name band and confirm your name and your date of birth. Can you tell me that?
Yeah, sure. My name's Sophia Hensley, and I was born on September 30th, 2012.
Yep, that's exactly who you are. And do you have any allergies to anything?
No, not really. I don't think so.
Okay, perfect. So do you mind if we sit down and have a little chat?
Sure, that's fine.
Okay, so you're telling me that you're having these really bad headaches and you're worried about that. Is that correct?
Yeah, they've been happening a lot lately. It's kind of scary.
Yeah, I can see how that might be really frightening.
Yeah, it's just that I don't understand why this keeps happening. I'm usually healthy, but lately.
Okay, so do you remember the doctor coming and telling you about um this disorder called systemic lupus erythematosus?
Yeah, I think so. But I don't really understand what that means. Is it something bad?
Well, it's an illness that you have, and it is something where they call it autoimmune, and it's something where this the things that attack germs in your body kind of attack your own cells, your own body. And that's what's happening with you.
Oh no. Does that mean I'll be sick forever? Will I ever feel better?
That's a really good question, and you're really smart to think about that. This is an illness where it will stay with you all the time. You're right. You're going to have this for the rest of your life. But you will have periods where you're going to feel better, and you'll have periods where you're going to be sicker. And that's kind of what you've been experiencing, right? Where you get this rash or you get the headaches and they kind of come and go. That's going to happen to you through your life. But we're going to do some things like give you medicines and show you some things that can help you feel better more of the times than feeling sick.
I hope so. I just want to feel better most of the time. Do you think I'll be able to go back to school soon?
Yeah, I certainly hope so. That's what we're going to do while you're here is help to start you on some of these medications that are going to help you to feel better so that you can go home and get back to school.
Okay, I hope so.
Yeah, me too. So I want to talk a little bit about the headaches. The headaches that you've been experiencing are a very common symptom of lupus. We're going to start calling it lupus because systemic lupus erythematosus is a really long, hard thing to say. So lupus is a little bit easier, don't you think?
Yeah, that sounds better.
Okay. So headaches are a very common symptom of lupus. Um, and so I want you to, I know it seems very scary that you've been having them, but I want to at least let you know that it's a common thing that you have with lupus and it's not an indication of anything more serious going on with you, okay?
Okay, I guess that makes sense. But what about Heather? She got really sick from her headaches. Are mine gonna make me that sick too?
Heather's your friend, right?
Yeah, she's my best friend. We're in the same class.
Yeah, and I can understand why you're scared about Heather because Heather was actually diagnosed with a brain tumor, isn't that right?
Yeah, that's right. Her headaches were really bad, and then she ended up in the hospital.
Yeah, and I can understand. That's very scary that you would have some symptoms similar to hers, and it's probably very sad that your friend was really sick like she was. But Heather's case is completely different. Her headaches were actually caused by a tumor that was in her brain. That is something completely different than what's happening with your body.
I see. But what if my headaches aren't just regular headaches?
I can see where that might be a thought that you would have. One of the things that we know is that we know what's happening with the lupus, where it causes your blood vessels to get really small. And that's why you have headaches because the blood's trying to get through this very small tube, your blood vessels. And that's what causes the headaches in your condition. They've done some testing with you already where they've looked at your brain and can see that you don't have a tumor, and that's how they know that it's not the same thing as with your friend Heather.
Okay, I think I understand. But what if my headaches get worse? Should I tell someone?
Yeah, you absolutely should tell someone if they're getting worse or if you're noticing anything else that's different. You should always let your mom or me or any of your other nurses or doctors know so that we can take a look at things, okay?
Okay, I'll try to remember that.
Okay, that sounds great. Is there anything else that we need to talk about right this minute?
No, I think I'm good for now. Thanks for explaining everything.
Absolutely. I'm going to go out and I'm going to write down all the things that we just talked about. But if you need anything else, you can use that call button that's right there next to the side rail on your bed. Okay.
Okay, thanks.
All right. I'll be back to check on you in a little bit.
Okay, I'll wait.
All right. So I'm going to go over here and end our conversation and look at my review to see how I did. And you can see it's generating my rubric. I needed 4 sections are needed to pass. I can see, and I passed 5. That's really good. So I can see the first 2 I covered. Oh, everything. And I covered everything in these last 2. Oh, except for I didn't discuss medications to relieve the headaches. That's really important. Oh, and the back method, which means that I should have asked her to tell me back the things that I told her to make sure that she understood. But other than that, it looks like I covered all of the points. Yay me. But I could go back and do another conversation after I've seen this feedback to make sure I included those 2 points that I missed.